Hello, everyone. On behalf of Flex, I'd like to welcome you to our webinar where we'll be discussing Trump's impacts on the Affordable Care Act. My name is Nicole Smith, and I'll be your moderator today. I'm a benefits education specialist here at Flex, and I plan and organize all of our educational events for human resources professionals and insurance producers. We've got a great presentation for you today, but before we get started, I wanted to take care of a few housekeeping items. First, whether you've dialed into the audio conference or you're listening through your computer speakers, please note that all of the phone lines and microphones have been muted, and we will not be opening them during the webinar. If you do have questions at any time during the presentation, you can type them in using the chat function on the right-hand side of your screen. We will answer as many questions as possible at the end of the webinar. This webinar is pre-approved for one general HRCI recertification credit and one SHRM professional development credit, or PDC. In order to qualify to receive credit, you must remain on the webinar for the duration of the presentation. Those who qualify will receive certificates of completion via email from Flex within 2 to 3 business days. A copy of this presentation was available to download on the WebEx login page as you join the webinar today, but don't worry if you missed it. We'll send you a copy via email as soon as a follow-up to this webinar. Before I introduce our speaker for today, I'd like to give a quick overview of who we are and what we do. We are Flexible Benefit Service Corporation, also known as Flex, and we're a benefits administrator and general agency located in Chicago, Illinois. We've been around for almost close to 30 years now. As a benefits administrator, we offer consumer-driven accounts and compliance services. Our product portfolio includes FSAs, HSAs, HRAs, and commuter plans, as well as COBRA administration, ERISA wrap documents, cafeteria plans, and non-discrimination testing. We offer integrated debit cards, automated claims technology, a website and mobile app for participants, educational resources, and a whole lot more. Currently, we have over 3,200 clients nationwide with more than 200,000 participants. As a general agency, we offer concierge-like services to independent insurance producers in the group, individual, and Medicare marketplaces. We provide assistance with sales, service, marketing, and business processing functions. You can learn more about Flex by visiting us online at flexiblebenefit.com. Okay, now that we've got all of that out of the way, I'd like to introduce our speaker for today, David Lindgren. David is a senior manager here at Flex, and he oversees our compliance and public affairs departments. He's a subject matter expert in the areas of ERISA, HIPAA, and the Affordable Care Act, as well as cafeteria plans and consumer-driven accounts. David is a frequent speaker at the SHRM annual conference and will be speaking again this year at the conference in New Orleans. David, thank you so much for being here today. I am going to go ahead and hand this off to you now.
Well, thank you very much, Nicole, for the kind introduction, and I'd also like to welcome everybody to today's presentation. We've got a rather hot topic to cover today, and when I say a hot topic, healthcare is really a very sensitive subject matter to most of us. It impacts all of us in some way, shape, or form. It impacts me, it impacts you, it impacts your employer, it impacts your families and your friends and your finances. So it is a very important subject matter that we're going to go over today, and I hope you'll find it informative and it'll get you up to speed as to what's going on with repeal and replace. So our agenda for the duration of the rest of our time here today, while relatively short, we hope will be impactful with some great material for you. So we're going to review the current efforts of the Republican repeal and replacement efforts. And through that, we're going to talk about the process that may be used in order to repeal and replace. Then we're going to speculate on the timing of when some things can change. And then ultimately talk about how these changes, whatever they may be, how that will impact the employer market segment, including employer-sponsored health insurance. Now, I do want to point out that in order to talk about some of the impacts to the employer market, we do have to talk about some of the changes to other market segments that are going to be influential to the employer market. So that being said, just if we take a 10,000-foot view of what the Republicans are trying to accomplish with their repeal and replacement agenda, these are the 5 or 6 key objective items that we've been able to identify. We've heard them, Republican leaders on a number of occasions say one of their primary goals is deregulation at the federal level. They want to push more control to the state level. They feel that all of the mandates of the Affordable Care Act has really paused healthcare innovation, and it has made it very difficult for people to provide access or gain access to quality, affordable coverage. So they believe that the Affordable Care Act is actually accomplishing the opposite of what it was sold as. So they do believe in free markets as being a key driver to healthcare innovation. Oftentimes I've heard Republican officials talk about telemedicine and how the free market created that and has given people the ability to contact a doctor over the phone without having to incur any medical expense or a very low medical cost, and get prescriptions for very common illnesses like the cold and flu. So one example of how they feel free markets can drive healthcare innovation. There's also been a lot of talk at the Republican level about interstate commerce, and that being a key agenda item as it relates to healthcare. And in particular, they're talking about giving employers as well as individuals the ability to purchase health insurance across state lines. Most regulations today require you to purchase health insurance coverage from an insurer that operates within the state in which you reside or in which your employer resides. Another agenda item is to eliminate many of the healthcare taxes that the Affordable Care Act imposes. There's about 20 direct or indirect taxes. For example, there's a $15 billion yearly tax on the pharmaceutical industry, and they believe those costs are being passed down in the form of higher drug costs, and that's driving higher out-of-pocket costs to individuals or higher premiums for those insurance plans. So they want to get rid of some of those taxing finance provisions. And then they are big believers in health savings accounts and want to extend those and improve the features of those accounts. And again, this is just sort of the 10,000-foot view. Now, I want to start sort of the core of the presentation with talking a little bit about the process of repeal and replace. And before I get into that, I want to open up a polling question to all of you. So you should see popping up on the right side of your screen now a question for you to answer. And if you're willing and able, we'd love to get your input here. But want to know, do Republicans hold enough seats in the Senate and House to repeal and replace the entire Affordable Care Act law? Do you think yes, they do, no, they don't, or are you uncertain? Again, do Republicans hold enough seats in the Senate and the House to repeal and replace the entire Affordable Care Act law? Yes, no, or uncertain? And Nicole, if you want to release the results, we'll share that with our attendees today on their thoughts.
We're just waiting for a few more people to finish answering, so 1 second, David.
Okay, no problem. We'll give it another few seconds to answer, and we'll share the results here. All right, so the results are in. It looks like about a third of you believe yes, they do. About a quarter of you believe no, they don't. About 20% are uncertain, and some of you chose not to answer, which is okay. But I think it is important to talk about the process. And here's where we stand with the current 115th Congress. They were sworn in on January 3rd of 2017, so about 2 months in office now. And they currently have 238 Republican House members. And with Republicans largely supporting repeal and replacement efforts, they only need 218 votes. So on paper, that looks good for them in the House, that they're going to have enough votes to achieve a repeal and replacement agenda. However, I like to say it's a House divided. Although there's 238 members, it's almost as if there's 238 different ideas as to what should be done with repeal and replacement. Some believe it should be completely scrapped and start fresh. Others just want to go after certain parts of the law and make changes, and you have really anything in between there. So really replacement is really stalling some of the objectives of moving forward with changes to the Affordable Care Act. Now, on the Senate side, they just barely have the majority. There's 100 Senate seats, and they have 52 of them, so just barely having the majority. And to do a complete repeal of the entire Affordable Care Act law would require 60 Republican votes. So on paper, that looks bad. They don't have enough votes to repeal and replace if that's what they want to do. However, there is something referred to as the budget reconciliation process, and through this process, Congress can pass bills. They're referred to as reconciliation bills or budget reconciliation bills, and they can pass certain bills with just a simple majority vote in the Senate. So they only need 51 votes, not 60, to pass a budget-related bill or a reconciliation bill. Now, the thing with budget reconciliation bills is, as the term budget suggests, they can only pass bills that are impactful to the federal budget. So it's got to impact either the federal government's spending or the federal government's revenues or some combination thereof. So they don't have the means to repeal, unless they could get Democratic support, they don't have the means to repeal the entire Affordable Care Act law. But they can repeal some rather big-ticket items. They can repeal things like the individual mandate, the requirement to have health insurance or pay a penalty. They can repeal the employer mandate, where larger employers, 50 or more employees, have to offer coverage that meets certain standards or penalties may apply. They can repeal the exchange subsidies that help both individuals and small businesses offset some of their premium expenses. They can repeal Medicaid expansion, and they can repeal the Cadillac tax that's not yet in force. On paper now is scheduled to take effect in 2020, but it is something they could repeal because it does impact the budget. Now, on the other hand, they couldn't repeal things that are included in the Affordable Care Act that are unrelated to the federal budget. So they couldn't repeal, as an example, the requirement to cover children up to the age of 26. Or they couldn't repeal the requirement that insurance companies have to issue coverage to people regardless of their health status. Now, on the record, they've also said those are some things that they think are good and they like in the Affordable Care Act and that they would include going forward. But just sort of keep that in mind right now. The makeup of Congress doesn't give Republicans the ability to do a complete repeal and replace of the Affordable Care Act. So just some simple takeaways for the process. Repealing seems to be a little bit easier for the Republican Party. They can do that with the simple majority in that they only need those 51 senators as opposed to 60. But again, replacing many parts of the Affordable Care Act would require 60 votes. So you're going to need all 52 Republicans in the Senate, plus at least 8 non-Republicans, either independents or Democrats. And that's very unlikely. As an example, when the Affordable Care Act was signed into law back in 2010, not one Republican voted in support of it. So the expectation in repealing and replacing the Affordable Care Act would be that not one Democrat would support any repeal and replacement plan. So, we're about 6 weeks or so into this process with the new Congress, and it's created really an early stall. There was this promise that we heard from President Trump and some other Republican leaders that the Affordable Care Act would be repealed and replaced immediately, and we're by no means there yet. Still sort of in the procedural stages of what's going to happen next. And as I mentioned, Republicans don't have a unified replacement plan yet. There's a lot of ideas floating around as to what direction they want to take, but doesn't yet seem to be a consensus. And until that time happens, we're unlikely to see any significant changes with the Affordable Care Act law. So some of them want to move forward and repeal and then figure it out later what we're going to replace it with. Some want to repeal and replace simultaneously. And I don't know what the best answer is or what the best course of action would be. But with that being said, I would like to get your input as to what you think Republicans should do with the Affordable Care Act. Do you think they should not vote to repeal? Do you think they should wait to vote to repeal until replacement details are known? Do you think they should vote to repeal immediately and then maybe figure out some things down the road? Or maybe you don't know at all. So again, if you're willing and able, we're going to open up another poll question for you. We only have 3 today, so try not to put too much work on you. But just want to get your input, what the audience here today thinks as we talk about repealing and replace. Again, should not vote to repeal, should wait to vote to repeal until replacement details are known, should vote to repeal immediately, or maybe you don't know. Again, this is healthcare. It's a sensitive subject, very impactful to all of us. So a lot of ideas and a lot of beliefs as to what should happen. So Nicole, whenever you're ready to release the results, you can shut the poll questions down and release the responses to the audience so we can get an idea of what our HR and business professionals that are on the phone with today are thinking. So again, we'll just give it a few more seconds and release the results. All right, so just 4% of you say should not vote to repeal. Looks like the vast majority, almost 2/3 of you, want to wait to vote to repeal until replacement details are known. That seems a very logical approach. About 6% of you want to vote to repeal immediately, and 4% don't know. So I want to compare your results. You should still see them on the right side of your screen to a poll that was recently done by the Kaiser Family Foundation. They're a nonprofit agency providing a great deal of information to the public as it relates to healthcare, and this was done on a much larger scale to several thousand people, not just HR and business professionals. So the Kaiser Family Foundation said about 48% should not vote to repeal. So that's largely different than responses that we got today from you, but I have seen some polls that are suggesting that the Affordable Care Act, its approval rate is actually at an all-time high right now. And that's largely believed to be because of the uncertainty as to what's going to happen down the road and a fear that people may not be able to access coverage or affordable coverage for that matter. 28% of the Kaiser survey said wait to vote to repeal until replacement details are known. 18% of surveyed responses vote to repeal immediately, and about 6% don't know. So just comparing sort of responses from our attendees today versus one that was done on a larger scale. So that talks a little bit about the process. So it's largely believed that whatever is going to be done to repeal and replace the Affordable Care Act is going to have to be done through the budget reconciliation process. So it does not appear at this stage that the entire Affordable Care Act law would be repealed and replaced. But again, some rather significant components could go away and be modified. Now, President Trump became our 45th president of the United States on January 20th, so he was sworn in about 2.5 weeks after House members and senators were sworn in. And if you were following at all his inauguration day, within just a few hours of being sworn in as president, while he was not able to repeal and replace the Affordable Care Act on the first day of his swearing in, as he had indicated, he did issue an executive order as it relates to the Affordable Care Act. It's about maybe a page and a half long, but there was one thing that really stuck out there, and I'm going to read you a rather lengthy sentence here that you should see on your screen in italics. But his executive order directed agency officials, such as those involved with the Department of Health and Human Services or those at the IRS who are largely involved with regulating the Affordable Care Act. He instructed them by virtue of this executive order to waive, defer, grant exemptions from, or delay the implementation of any provision or requirement of the Act that would impose a fiscal burden on any state or a cost, fee, tax, penalty, or regulatory burden on individuals, families, healthcare professionals, health insurers, patients, recipients of healthcare services, purchasers of health insurance, or makers of medical devices, products, or medication. So, sorry, that's a rather lengthy statement there, but if you start to take a look at it, that starts to sound like, hey, you need to start regulating things like the individual mandate and the employer mandate and taxes and any other financially impactful item. You need to start easing the regulatory enforcement on that. And I think it is important to understand that there is a difference between passing a law, which requires a bill to be signed in the House and then subsequently signed in the Senate and then ultimately signed into law by the President. There's a difference between that legislative process versus enforcing or actually regulating or policing a particular law. So while the executive order came out, it immediately kind of created some shock in the industry, and the immediate reaction was, oh, the Affordable Care Act is gone, day one. Not so fast. It's just saying ease up the regulatory requirements if you are legally able to do so within the federal law. And so what I wanted to do is take a step back first and think about, okay, well, what did the Obama administration do through regulatory action, not through legislative action, but through regulatory action? And these are some things that were done generally either in the Department of Health and Human Services, Department of Treasury, or the Department of Labor, or some combination thereof. Those are referred to as the tri-agencies, largely the principal regulators and enforcers of the Affordable Care Act. And some of the things they did that did not require a passage of a law was they created additional exemptions to the individual mandate, so more people could avoid the penalty even though they were uninsured. They also delayed the employer mandate by 1 year. That was supposed to take effect in 2014. It got pushed back a year to 2015, and then it was phased in over a 2-year time period, becoming fully implemented last year. And then they also delayed the Affordable Care Act reporting requirements, those Form 1095B and C forms that many of you probably have worked with over recent years. So those are some of the things that were done under the Obama administration. So the immediate reaction is, so, well, what's the Trump administration going to do based on the executive order and instruction to regulate some of these things differently? And ironically, the first set of regulatory guidance had nothing to do with the executive order. It actually had to do with stabilizing and preserving the insurance exchanges in the individual market that were essentially created by the Affordable Care Act. So you'll see 5 sub-bullets shown there. These are all things that health insurance companies have said they need in force in order for them to continue offering plans on the insurance exchanges or the individual marketplace. So plans that you would find on healthcare.gov or a state-run insurance exchange. So these are proposed rules. They're actually open for public comment until March 7th. But the first set of regulatory guidance is going to shorten the next open enrollment period for 2018 from 90 days to 45 days. It's going to require more pre-verification for special enrollment. Anybody that signs up outside of the open enrollment period is going to have to provide documentation proving they're eligible for a special enrollment period. They're going to reduce what the insurance companies are saying are abuses of grace periods for late premium payments, where people wait till the end of the year and only pay their premium if they actually incur a medical expense. And if they don't incur a medical expense, they just don't pay the premium. They let their coverage lapse, and then they re-enroll in a new plan the next year. So the insurance companies are saying they're gaming the system a little bit there. They're going to allow more plan designs relative to metallic tier status. This will be impactful to the individual market as well as the small group market. If you're familiar with the bronze, silver, gold, and platinum plans, they have to meet some rather specific requirements to fall into one of those categories, and they're going to ease up those requirements to allow more plan designs to qualify for the appropriate status. And then they're going to provide some additional time for insurance companies to file their plans and rates for the 2018 plan year. It was supposed to be May 3rd. Now it's looking like it's going to be closer to the end of June. So again, the first set of regulatory guidance is trying to sort of continue with the Affordable Care Act as opposed to replace it or change it, which has some irony. So I think we at least know from this guidance that the ACA exchanges, the media calls them Obamacare, they seem like they're going to be around at least until the end of 2018, if not later. Now, the only, at least publicly known thing at this time was a direct response to Trump's executive order was how the IRS is going to regulate the individual mandate. So under the Obama administration, the only way the IRS would accept your federal income tax return is if on that tax return you attested to having health insurance, you claimed an exemption from the individual mandate, or you paid a penalty for being uninsured. If you didn't do one of those three things, your tax return was rejected and you'd have to update it and refile. Well, the IRS made an announcement a couple weeks ago in response to the executive order that says, hey, if you omit any information about your current insured status, we're still going to process your tax return. So that seems to imply really an easing of the individual mandate penalty for those that are uninsured. So now I want to switch gears a little bit, and let's really now talk, like, what are things of substance that could change or go away or be modified significantly? And there's a couple of things we're going to talk about, a couple of documents we're going to talk about. One of them was made publicly available by GOP officials, and the other one was actually a draft of a bill that got leaked and has garnished a lot of talk since its leakage. So the first thing, the first document I'll mention is being referred to as a policy brief. And in the middle of February, House and Senate Republicans met alongside with Tom Price, who is now the Secretary of the Department of Health and Human Services, and he's a physician and has really his own agenda for what he feels should be repealed and replaced. But they had these closed-door meetings to try and figure out, okay, what is our repeal and replacement plan? And no formal plan actually was introduced or came about as a result of these meetings. However, they did make this policy brief available. I view it almost like a marketing or advertisement piece from the Republicans on why they think the Affordable Care Act law is failing and what are sort of their general ideas as to how they would replace and move forward with healthcare and healthcare reform. If you want to do an internet search for it, a Google search, whatever, it's called the Obamacare Repeal and Replace Policy Brief and Resources. Probably a 20, 25-minute read, but sort of give you their perspective on what should happen with repeal and replace. So that was that was intentionally made available to the public. However, unintentionally, Politico, the media outlet primarily focusing on political media information, they got their hands on a rough draft version of an actual ACA repeal bill. This would be a budget reconciliation bill. And they made this available to the public. They put it out on the internet last Friday. So it's still, people are still soaking up what that means. It's, I believe, 106 pages long. So a lot of material is in there. And I have had a chance to look through it. And if you are at all familiar with Speaker of the House Paul Ryan's previously introduced repeal bill in the 114th Congress, it's called A Better Way. It looks a lot like Paul Ryan's version of repeal and replace. This bill, our understanding is still in the process of being scored by the Congressional Budget Office. And what I mean by that is whenever there's a budget reconciliation bill, it goes to this nonpartisan agency called the CBO, or the Congressional Budget Office. And one of the things they do is they score it and they indicate what the financial impact is to the federal budget. So my understanding is they were still in the process of doing that. Now, the bill itself, it was leaked on February 24th, but there was a date in it that it was, the rough draft was put together on February 10th. So we're about 3 weeks from that time, and it's likely already outdated. In fact, it is outdated. Republican leaders have said, hey, that's just a rough draft. We're still going to go back, mock it up, make some changes to it. And there are some Republicans that said, hey, we see your rough draft bill and we don't like it. So if you move forward with this bill, we're not going to vote for it. So it's clear that even though they may have a bill that could be introduced, they don't seem to be quite there yet with a unified replacement plan. But again, this does give us some ideas as to what they're thinking. And what I will tell you is when you take a look at both the policy brief as well as this leaked bill, it is heavily focused on reforming the individual marketplace and the Medicaid marketplace. There are some things that impact Medicare and some things that impact the employer market. We're going to definitely talk about what impacts the employer market. But it does appear their main objective is to reform, repeal, replace, whatever R word you want to use. They're going to go after primarily the individual and Medicaid markets where they believe there's a lot of volatility and instability. So I'm going to share some information with you. But I want to ask you, last poll question, which market segments do you believe would benefit the most by repealing and replacing the Affordable Care Act? And the reason I ask is that, you know, the employer market is the largest market segment, insuring about 180 or so million people. The Medicare market is the second largest market, insuring about 50 to 55 million people. And then, you know, the Medicaid and individual markets are the smaller markets in terms of how many people they cover. So what market segments do you believe should be repealed and replaced or would benefit the most? Is it the individual, the employer, Medicare, Medicaid, or maybe none of them? Maybe you think they're all, you know, sufficiently working fine today. So again, individual, employer, Medicare, Medicaid, or none. Give you a few more seconds here to provide your responses, and then we'll have Nicole open up the response rate for you. So just a moment here.
We've got a few people still finishing up, so let's give them a few more seconds, okay?
Okay, great. All right, so for those of you that were able to respond, it looks like you believe the employer market needs the most repeal and replacement. About 38% of you think that market it needs the most work, followed by the individual market, and then looks like Medicare and Medicaid sort of coming in at a tie at the end. So I don't think there's a right or wrong answer. It is some of this maybe you may be responding for personal reasons. Some of you may be responding for professional reasons, and well, certainly you can have different answers. But I just think it's important to point out that depending on who you are and what your circumstances are, that's largely probably going to impact your ideas as to what things need to change. So let's talk a little bit more. Let's get into some substance here. And these are some stats that I pulled from the policy brief, again, that was made publicly available. And these are the reasons Republicans say they need to, or we need to, repeal and replace the Affordable Care Act. So, again, this is not an all-inclusive list, but just some things here. They cite that about 1 out of every 3 counties in the country now only has one health insurance company offering a plan on the exchange. And if we don't do something to make changes, eventually that's going to be no companies. And so that is one of their primary concerns. I'm quoting, they use the term rescue mission. They're on a rescue mission to save the individual market from total collapse. And they also point out there's these insurance companies that are referred to as co-ops. They were created by the Affordable Care Act. They received low interest rate loans from the federal government to essentially become a new startup insurance company, primarily focusing on offering coverage in the individual and small group marketplaces. Well, 18 out of 23 of those co-ops have failed. They've gone out of business, or they've been instructed to no longer enroll any new individuals due to solvency problems. They also cite premiums and deductibles are soaring. This year, there's an estimated 25% average premium increase for health insurance plans sold on the exchange. And the premium spread varies. If you're in a state like Arizona, some of those plans saw rate increases in excess of 100%. But if you're in a state like Indiana, their rate increase was relatively flat and in some instances actually decreased. They point out that there's a new kind of uninsured. I refer to them as underinsured. But they point out that based on the plan designs that are out there now, people have such high deductibles and such high out-of-pocket expenses, and the networks of doctors and hospitals have gotten smaller, that it's prohibiting access to care because people don't have the means to pay for some of these services due to the high cost. And they also point out that there's about $1 trillion in new taxes that the Affordable Care Act has created, both direct and indirect taxes, that ultimately they are citing are being pushed down to employers as well as individuals, and that's driving up out-of-pocket costs, and it's driving up premiums. Now, that's sort of, again, I would say that's more of their high-level policy brief. But here's some information that was actually in the leaked bill, not an all-inclusive list, but here's some information that their first rough draft bill says they're going to do. They're going to eliminate the individual and the employer mandate. They're going to get rid of every Affordable Care Act imposed healthcare tax. Again, there's about 20 of them. They want to get rid of all of them. Going back to federal deregulation, they want to give states more power to determine what benefits are quote-unquote essential. Right now, the federal government requires health plans to cover 10 categories of benefits with unlimited annual and lifetime dollar limits. And according to the Republican agenda, they think states know their population and their residents better, and those states should decide what benefits health insurance plans should cover, not the federal government. The proposed bill has some what I'll call expansion objectives. Continue to allow Medicaid expansion, more higher income levels to qualify for Medicaid. However, they want to make some changes to it, and those changes generally require or impose less federal funding and more state funding if a state chooses to continue with Medicaid expansion. They want to provide tax credits in the individual market. This is a little bit of a different spin as to what the current Affordable Care Act tax credits do. The current tax credits are based on income. So the more money you make, the less of a tax credit you receive, and vice versa. The less money you make, the more of the tax credit you receive to offset your premium and or out-of-pocket expenses. Well, they want to offer individuals who don't have access to a government-sponsored plan or who don't have access to a group health plan tax credits ranging from $2,000 to $4,000 based on age. And then they also want to establish what they're referring to as a state innovation program, which over a period of several years would provide $100 billion of money to states to quote unquote innovate, to find ways to offer access and health insurance to their higher risk population. So, again, Medicaid expansion, individual coverage tax credits, and the state innovation program are their expansionary objectives, ways to provide more care and more access to health insurance. And the reason I'm emphasizing that is because there has to be a way to pay for those things. It's not free. Okay, under the current model, there's these Affordable Care Act taxes, individual mandate, employer mandate, taxes on medical device makers and pharmaceutical manufacturers. And those things all end up funding some of these expansionary efforts. So how are they looking to fund these expansions if they're getting rid of all the taxes? Well, that's where the employer market gets sort of swooped back in. You probably know about the Cadillac tax, not yet enforced. Again, right now, absent repeal would take effect in 2020. They're looking to do something similar to the Cadillac tax. And for those of you that don't know, employer-sponsored health insurance is the largest tax deduction in the entire country as a whole. Because employers and employees can pay for their insurance through their employer tax-free, it ends up costing the federal government, depending on who you ask, somewhere around $300 billion per year that they're not getting because of these tax deductions. And according to the leaked bill, the sole funding mechanism to expand coverage in the individual and Medicaid markets is to place a cap on how much coverage could be paid for through an employer tax-free. Now, the leaked bill says it's proposed to be the 90th percentile of current premium. That's pretty much undefined right now. What does that mean? Is it 90% of each employer's specific premium? Is it 90% of the average premium in the country? Will there be variations based on maybe geographic location or other variables? What all goes into that tax exclusion? Is it just health insurance, or is it health plus HRAs and FSAs and dental and vision? So, we don't have specifics yet, but at a high level, what you would need to understand is right now, it appears they're looking at placing a limit on employer-sponsored coverage, and that is the sole mechanism, absent changes down the road, of how they plan to fund individual and Medicaid expansion. So as the bill, the rough draft version, and again, a lot of this can change, it says this would start to take effect in 2019, so not that far out. Now, what are some other things that you should be aware of? Well, absent this limit on how much could be paid for tax-free or how much insurance could be paid for tax-free, it does feel a lot in the employer market like a return to the past. So, you get this federal deregulation, at least for fully insured plans, and state law becomes the principal governing law. So, each state can have different rules and regulations as to what health insurance plans have to look like and how much they cost. And then ERISA would be the principal governing law for self-insured plans. And, if we go that way, that means, there's going to be a lot more flexibility with plan designs, with employers determining who's eligible or ineligible. So you could see a whole spectrum of plans, very catastrophic plans that just cover, accidents and severe illnesses, all the way up to very generous plans that cover most medical care services. So that's what it kind of feels like. We'll have to see what the ultimate law evolves to and becomes. And then we'll talk about the employer mandate, because I know that's impactful to several of you today. And as I mentioned, they're looking to get rid of that and get rid of that quickly. So that may ease some concerns for those of you that have been trying to comply with its rules. And I know there's a lot of administrative work that goes with it. But what I want to point out is that even if it goes away, that does not necessarily mean that the ACA or similar reporting requirements go away. So these forms that you're filling out, the 1095-C forms, and if you're a smaller employer with self-insured coverage, the 1095-B forms, yes, those forms are used to regulate the individual mandate as well as the employer mandate. But what's not often talked about is that those forms are also used to help the IRS determine who's eligible for tax credits or subsidies in the exchange. If you're not familiar with all the rules, if you have access, I'm not going to define this, but if you have access to an affordable health plan with minimum value through your employer, that disqualifies you from gaining access to tax credits or subsidies in the exchange. So there may be some reporting requirements still imposed upon employers. What exactly that looks like, we don't know. It would probably be a simplified version if there were to be a reporting requirement. But absent a reporting requirement, it would be the quote-unquote honor system for people to get tax credits. And Republicans believe there's a lot of fraud, and in particular fraud with health care. So they may say, hey, you know what, employers, we still need your help with policing these tax credits. So we'll have to see how that all shakes itself out. So if you're excited that the employer mandate is going away, don't jump for joy quite yet, because there still may be some reporting required. And then just to talk quickly about FSAs, HRAs, HSAs, the Affordable Care Act put a limit on FSAs. The most that an employee could salary reduce is $2,500 indexed for inflation. That cap would go away. No more requirements for an FSA or HSA for somebody to get a prescription for an over-the-counter drug to make it an eligible tax-free reimbursement. Due to flexibility in health plan design, that would mean there would likely be a lot more health reimbursement arrangement options that could be made available. And as I mentioned, HSA expansion is a big agenda item. Actually, Marco Rubio and Orrin Hatch in the Senate introduced the Health Savings Act of 2017. I say it's reintroduced because a very similar version was released in the previous Congress. And really, it just increases contribution limits, increases the types of eligible expenses, and makes them a more attractive benefit. So that gives you an idea there. So I want to wrap up here with a few final comments, and I'll turn it back to Nicole, and we'll go through a couple Q&A questions. But, the timing, when's all this occur? We don't have a formal bill on the floor yet. Nothing's been voted on yet, so really it's largely speculation. But if you take a look at, some of the comments that have been made, if you go through the leaked bill and the policy brief, we can see that the employer and the individual mandates, as well as the ACA, many of the ACA taxes, they're looking to do a quick and immediate repeal, possibly retroactive either to 2016 or earlier. So we'll have to keep our eyes on that. But what I'll call the non-expansion items, it looks like those would be next year agenda items. When I say non-expansion, I'm talking about things like letting states determine, the appropriate plan design, but things that are expansion related, things that change Medicaid, things that change the tax credits in the individual market, those appear to be things that are going to be a few years out, possibly 2020. Again, the longer it takes to get down the road here with repeal and replacement, the more likely it is that these things will be delayed to later years. So, just a lot of timing issues. It doesn't appear that it's going to be like a full swoop done all at once. It does appear that there's going to be some transition, at least with certain components. So we're talking about repeal and replace. We're not there yet. whether you support it or don't support it. We're definitely not there yet. So the Affordable Care Act is still, the ruling law, one of the principal regulatory laws for employers alike. And so the employer mandate is still in play. The ACA reporting, as we know it today, is still in play. And for those of you submitting electronically, you have until the end of this month to get that in. The exchange notices still need to be provided to new hires within 14 days of their start date. Still have the summary of benefits and coverage document that you need to be distributing at the appropriate times. For a newly eligible employee, still have the 90 calendar day waiting period. For those of you that issue 250 or more W-2s, still got to report the value of coverage on those. And then the Patient-Centered Outcome Research Institute fees or CORI fees, those still apply to health plans. If you're fully insured, the insurance company pays that, but if you're self-insured, you got to make sure you're filing that via Form 720. So these things still all apply amongst the other various requirements of the law. And even if we do ultimately get to repeal and replace, don't forget there's still a lot of other laws that are impactful to employers and employer-sponsored coverage. Just a couple examples: ERISA, Code Section 125, cafeteria plan rules. COBRA's been around for several years, still expected to be around if we have a repeal-replace plan. Form 5500 reporting still applies, non-discrimination testing, and so on. And sort of the last thing I'll leave it with before we open it up to questions is repealing, in theory, seems like it's the easy part for Republicans. But replacing is going to be the difficult agenda item for them. Not only do Democrats oppose repeal and replace, but as I mentioned, Republicans can't get on the same page as to how they want to move forward. So there's a lot of uncertainty as to what the repeal replace plan is actually going to look like. And as I mentioned, the most significant changes are expected in the individual and Medicaid markets, but the employer is definitely going to feel some change too. The employer mandate goes away. That would be something very impactful. But this tax exclusion, limiting how much can be paid for tax-free, that will definitely be a concern. And you'll probably hear a lot of folks on both sides of the political aisle that don't have huge support of this. Many labor organizations, unions are probably going to put their voice in this. So what that ultimately becomes, if anything, we'll have to see. And, healthcare has become a very political subject, and rest assured, politics is going to continue to play a huge role in the direction that healthcare and health insurance takes. And sort of the million-dollar question is, are we close to a formal plan hitting the floor yet in the House and or the Senate? And Republican leaders, Speaker of the House, Senate Majority Leader, President Trump, they've all said March is the month that a formal bill is going to be introduced. And I'll leave it at that, but just because a bill gets introduced does not necessarily mean it actually becomes the law of the land, because not everybody's on the same replacement page. So that being said, I'll throw our contact information up on the screen, but Nicole, I'll turn it back over to you for any final comments and if we want to take a few questions.
Great. Thank you very much, David. If you do have questions, please feel free to submit them now. You can send them in through the chat function on the right side of the screen or through the Q&A tab as well. So I'm going to give you guys a few minutes to send in any questions. And we'll just go over a few housekeeping items again as well. So if you've made it this long in the webinar, you're probably qualified for credit. So keep an eye out for an email from Flex the next 2 to 3 business days. We're going to send you certificates of completion that will give you the course numbers so that you can claim your credit for HRCI or for SHRM. We also send you a copy of the presentation. So if you weren't able to download it as you were logging in, that's okay. We will send a copy out of that afterwards as a follow-up. If you do have any questions or would like more information about Flex, please feel free to give us our call at the numbers here on the screen or visit us online at flexiblebenefit.com. On our website, you can also view all of our upcoming educational events, so keep an eye out for more webinars to come on this and similar topics. You can also watch any of our prior webinars that we've done. We have recorded versions available online in the video section, so if you'd like to see something that we've done in the past, please make sure to check it out, okay? I'm going to pause just for 1 second and see which questions we have here and pass those on to David. Okay, we have a question here from Carrie. Carrie wants to know, will employers still be required to offer health insurance to full-timers who change their status to part-time?
Well, if the employer mandate goes away, as the ACA repeal plan suggests, then the employer would get to determine who's eligible or ineligible. So we wouldn't have the same guidelines that exist today, and there would be a great deal of flexibility there. So you don't have to worry about the measurement periods or stability periods that the employer mandate imposes. So, however, if somebody did move from full-time to part-time and that were to cause them a loss of eligibility for coverage, your normal COBRA rules would apply in that scenario, not the employer mandate stability period rules.
Thank you, David. We have a question here from James. James asks, how will this affect employees who have TRICARE, if in any way?
It doesn't appear that TRICARE is what I'll call on the chopping block. So it appears that TRICARE will mostly remain as is. So I don't expect many significant changes with TRICARE, or at least Republicans have not suggested that would be something they would change. Was not mentioned in the policy brief or the leaked bill.
Okay, thank you. And I think we've got time for one more question here. So Helen asks, what was the name of the policy brief resource released in mid-February that you mentioned earlier in the presentation?
I'm going to go back to the screen here and put it on there for you. Just a moment. Sorry, you're probably seeing some slides. Right here, it's it's the first sub-bullet under the second bullet. It's called the Obamacare Repeal and Replace Policy Brief and Resources. It's a 19-page document, but a lot of it is just citing sources, or it's a cover page. So it really only amounts to about 8 or 9 pages of content. Again, probably a 20 to 25-minute read for you to get a high-level overview of their thoughts on why the ACA isn't working out and what their replacement agenda might look like.
Okay, great. I do not think that we have any more questions that have come in, so we're going to go ahead and wrap things up now. Again, thank you so much, everyone, for joining us. We do really appreciate it. We hope you have a great day, and keep an eye out for those emails from Flex. Thank you.
Thank you, everyone.